Lymphedema is defined as abnormal swelling of lymph caused by high protein interstitial fluid secondary to abnormal lymphatic drainage. So, it has normal capillary infiltration, but only the fluid is in draining. So, let's see how is it happen. Here you see that the arterial end and venular end. The interstitial fluid is drained at venular end as interstitial fluid pressure is decreased at that end. But the very small amount of the fluid you will see will come out, which is rich in protein and other macromolecules. It freedom from plasma. This fluid throughout the body is constituting about 8 liters. As it passes through the lymph node, it becomes double concentrated and half in volume. As you can see, it to pass from there and it become more concentrated and its volume will be half. So 4 liter would be drained after the filtration from lymph node. So this is the general physiology. So how can we classify lymphedema? We can classify into primary and secondary lymphedema. In true lymphedema, when the primary problem is in lymphatic, the edema fluid is high in protein as capillary filtration is normal. So, primary lymphedema has 3 types. The first type is congenital. Congenital has familial component as in miliary disease or sporadic. It occurs in children less than 2 years. Then Prexico, which occur same as familial like Meek syndrome or sporadic, and age when it occurs is 2 to 35 years. Then at last Tarda, which is third type, which happen after the age of 35 years. Now let's talk about the clinically how do it look. So clinically, the foot and ankle area is involved. It appears like buffalo hump, as you can see. Secondary pain is in the form of toothache or severe pain, or sensation is in form of burning along with that sensitivity to heat. Second, bursting. Third, pin or prick sensation. The skin problem associated with this is excoriation or ulceration, and second is athlete foot, which is fungal infection. So the investigation through which we have to go, angiography, in which you can see the congenital hyperplasia, in which lymphatics are increased in number but are defective. Second, distal obliteration in this slide, which is most common and occur in form of hyperplasia or aplasia, and this is the distal obliteration. The proximal obliteration at the level of otoilic or inguinal node is also present, but it will constitute 10% cases. 80% of cases are the distal obliteration. Second is isotope lymphoscintigraphy, in which radioisotope technetium is injected at interdigital space and the dye flow through the lymphatic channel, and serial radiographs are taken from gamma camera. The third investigation is CT scan. The CT scan of lymphedema gave honeycomb a pattern in subcutaneous area, as you can see in this slide. Edema pit on pressure but disappear on elevation. This is the picture. You can see there are four stages. The first is pre-stage. In the pre-stage, there is no clinically evident finding, but you can see that the leg is edematous. Then the first stage, the pit form on pressure and relief on elevation, showing disease is reversible. In the stage 2, the pit do not relieve after applying pressure. In the stage 3, irreversible skin changes, ulceration and pigmentation to happen. Now let's talk about treatment. So the main symptom, as we already discussed, is pain. So for pain, we give opioids and non-opioids like paracetamol. In opioids, we give a different opioid which have very significant addiction effect, like tramadol, and then paracetamol and antidepressant and muscle relaxant like baclofen, diazepam and mefenacin, which is centrally acting on nerve block, can also be used through ultrasound and ultrasound guidance. It is injected into limb. Then for second symptom, which is swelling, mild lymphedema, we can reverse it by elastic bands. Non-elastic multi-layer bandage in severe lymphedema can also be used, and compression garment is mainstay treatment in severe lymphedema. Pneumatic compression devices are also available nowadays, and it is most commonly used for lymphedema. Then the swelling, after the swelling we move towards the surgical. In the surgical, before going to surgical, we will discuss about the medical treatment. We use benzopyrones, which contain coumarin and flavonoids, are used to decrease the formation of lymph. In the surgical treatment, we use lymphovenous bypass, so that lymph will directly drain into the vein before going through the lymph node. The second surgical method is, as you can see, the wedge of tissue is resected, which is so swollen, and these operations are called cyst trunk operation. For the prevention after surgery, we give prophylactic antibiotic. Usually we give erythromycin 400 mg. For prevention of athlete foot, we give 0.3% benzoic acid, which is antifungal. Some basic measure like insect repellent, not walking barefoot, protection from sun, and protecting skin from sun, and applying liquid paraffin for dry skin, and if there is hyperkeratosis, then treatment with 5% salicylic acid should also be considered. In the secondary lymphedema, it is quite common, and there is a clear cause of lymphatic obstruction. There are causes like infection, eye filariasis, or a fungal infection like tinea pedis. Bacterial infection and TB infection are common causes. Lymphedema because of surgery or diagnosis in breast cancer, and usually it is associated with chronic venous insufficiency like varicose vein, DVT, superficial thrombophlebitis. So that's all with the lecture.